Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
End-of-life care discussions in Discourse Analysis. Interactive assistant end-of-life care discussions involve conversations between patients, families, and healthcare providers about the care, treatment, and decisions to be made as a person approaches the end of their life. In Discourse Analysis, these discussions are studied to understand how language shapes the meaning of life, death, and care, how decisions are negotiated, and how power dynamics between doctors, patients, and families influence the discourse. These discussions often involve sensitive topics such as palliative care, hospice care, patient autonomy, and medical ethics, and they are marked by emotional, ethical, and cultural considerations. Discourse analysis of end-of-life care discussions examines how participants use language to manage the complexity of emotions, how medical professionals communicate technical information in accessible ways, and how social, cultural, and institutional factors influence the framing of life and death decisions. Through this analysis, researchers can uncover the power dynamics, emotional tensions, and values that shape these crucial conversations. Key features of end-of-life care discussions in Discourse Analysis. 1. Framing of life and death. End-of-life care discussions often involve sensitive framing of life and death. Discourse analysis examines how life, death, and dying are constructed through language, focusing on how healthcare professionals, patients, and families navigate these profound concepts. Example: a doctor might frame death as a natural part of life to reassure the patient and family during difficult conversations. Discourse analysis would explore how this framing helps normalize death, easing emotional tension and allowing participants to discuss care options more openly. 2. Negotiation of medical choices. End-of-life care discussions involve the negotiation of medical decisions, where patients and their families must weigh various treatment options, including palliative care, life-prolonging interventions, or hospice care. Discourse analysis investigates how language is used to negotiate these choices and how medical professionals present or guide these decisions. Example: a healthcare provider might use language like, "It's important to think about quality of life versus quantity of life," subtly guiding the patient toward less invasive treatments. Discourse analysis would examine how this language frames certain choices as more aligned with patient well-being, shaping the decision-making process. 3. Patient autonomy and informed consent. Patient autonomy is central to end-of-life care discussions, with patients' rights to make informed decisions about their own care being emphasized. Discourse analysis looks at how healthcare providers communicate options and respect patients' autonomy, ensuring informed consent is given. Example: a doctor might say, "The decision is entirely up to you. My role is to provide the information so you can make the best choice for yourself," emphasizing patient autonomy. Discourse analysis would explore how this language positions the patient as the primary decision maker while balancing the doctor's role as an expert advisor. 4. Emotional and ethical considerations. End-of-life care discussions are emotionally charged and often involve ethical dilemmas around issues such as life support, euthanasia, or do not resuscitate (DNR) orders. Discourse analysis examines how language is used to manage emotions and navigate the ethical dimensions of care decisions. Example: in a family discussion about whether to withdraw life support, a healthcare provider might say, "We want to honor your loved one's wishes and make sure they are comfortable," focusing on emotional comfort and ethical considerations. Discourse analysis would explore how this language helps to balance ethical concerns with emotional support for the family. 5. Power dynamics between doctors, patients, and families. Healthcare professionals often hold more knowledge and authority in medical discussions, creating inherent power dynamics in end-of-life care conversations. Discourse analysis investigates how power is exercised or shared, and how language either reinforces or mitigates these dynamics. Example: a doctor might use technical jargon that is difficult for patients and families to understand, inadvertently asserting power through specialized knowledge. Discourse analysis would examine how the use of medical language affects the patient's ability to participate fully in the decision-making process, potentially limiting their autonomy. 6. Cultural sensitivity and religious beliefs. End-of-life care discussions are deeply influenced by cultural and religious beliefs, which can shape perspectives on death, dying, and acceptable treatments. Discourse analysis explores how language reflects these cultural and religious values, ensuring that care discussions are sensitive to the patient's background. Example: a healthcare provider might ask, "Are there any cultural or religious beliefs we should keep in mind as we discuss your care options?" Discourse analysis would explore how this language ensures that care decisions are made in alignment with the patient's beliefs, fostering a more culturally sensitive dialogue. 7. Conveying complex medical information. End-of-life care discussions often involve communicating complex medical information about prognoses, treatment risks, and potential outcomes. Discourse analysis looks at how healthcare providers translate medical jargon into understandable terms, ensuring patients and families can make informed decisions. Example: a doctor might say, "This treatment will help ease pain, but it won't extend life significantly," simplifying medical information about palliative care. Discourse analysis would examine how language is used to break down complex concepts, making the information accessible while guiding the conversation toward appropriate care decisions. Methods for analyzing end-of-life care discussions in discourse. 1. Critical discourse analysis, CDA. Critical discourse analysis, CDA, examines the power dynamics in end-of-life care discussions, focusing on how medical authority is exercised and how patients and families navigate the unequal distribution of knowledge and decision-making power. CDA explores how language reflects broader societal structures, such as the medicalization of death or institutional control over care decisions. Example: a CDA of conversations about life-prolonging treatments might analyze how doctors frame certain interventions as necessary or unnecessary, reflecting institutional values about medical intervention at the end of life. The analysis would explore how these discourses influence patient autonomy and the negotiation of care. 2. Frame analysis. Frame analysis investigates how different aspects of end-of-life care are framed in discussions, focusing on what is emphasized, e.g., quality of life, patient comfort, and what is downplayed, e.g., the inevitability of death. This method helps to reveal underlying values and assumptions in care discussions. Example: in a discussion about hospice care, the issue might be framed as comfort and dignity in the final days, rather than focusing on the cessation of aggressive treatments. Frame analysis would explore how this framing shapes the emotional tone of the discussion and encourages certain care decisions. 3. Conversation analysis. Conversation analysis looks at the structure and flow of interactions in end-of-life care discussions, focusing on turn-taking, interruptions, and the use of questions. This method helps to uncover how participants negotiate meaning and how power dynamics unfold in real time. Example: in a conversation between a doctor, a patient, and the patient's family, conversation analysis would examine how the doctor's questions guide the discussion and how family members interrupt or support the patient's decisions, revealing the dynamics of shared decision-making. 4. Narrative analysis. Narrative analysis focuses on the stories told during end-of-life care discussions, examining how patients, families, and doctors construct narratives about illness, care, and death. This method helps to uncover how personal and cultural narratives shape the decision-making process. Example: a patient might tell a story about a relative who received aggressive treatment at the end of life, using this narrative to justify their preference for a less invasive approach. Narrative analysis would explore how these personal stories shape attitudes toward care and guide the decisions made. Examples of end-of-life care discussions in discourse analysis. Example 1. Discussions about palliative care. In conversations about palliative care, doctors might use phrases like managing pain and improving comfort to frame palliative care as a positive, supportive option rather than a last resort. Discourse analysis would examine how this language reassures patients and families, positioning palliative care as a compassionate choice that prioritizes quality of life. Example 2. Family conversations about do not resuscitate, DNR, orders. In discussions about DNR orders, a doctor might say, A DNR order means that if your loved one's heart stops, we would not attempt to restart it, simplifying a complex medical procedure. Discourse analysis would explore how language is used to clarify options and how families process and respond to this information when making difficult decisions. Example 3. Physician-assisted death conversations. In discussions about physician-assisted death, a healthcare provider might use careful language such as, "This option is available for patients who wish to have more control over the timing of their death," emphasizing patient autonomy. Discourse analysis would examine how this language is used to respect ethical boundaries while informing patients of their legal rights. Example 4. Cultural sensitivity in end-of-life care. In a conversation with a family from a religious background that opposes certain medical interventions, a doctor might ask, "How can we ensure that we respect your beliefs in our care decisions?" Discourse analysis would explore how this language facilitates culturally sensitive care, ensuring that the patient's values are prioritized in the decision-making process. Example 5. Prognosis communication in end-of-life care. When delivering a prognosis, a doctor might say, "There is no cure for this condition, but we can focus on making you as comfortable as possible," balancing honesty about the prognosis with a focus on comfort. Discourse analysis would explore how this language helps patients come to terms with their condition while providing a sense of agency in choosing their care options. Challenges in analyzing end-of-life care discussions through discourse. 1. Emotional complexity. End-of-life care discussions are emotionally charged, making it challenging to analyze how participants manage emotions through language. Discourse analysts must be sensitive to how emotions like grief, fear, and hope are expressed and navigated in these conversations. 2. Cultural and ethical diversity. Cultural and religious beliefs play a significant role in end-of-life decisions, and discourse analysts must account for the diversity of perspectives that influence how care is discussed and understood. This requires an understanding of how different cultures frame life, death, and care. 3. Power dynamics in medical conversations. Power imbalances between doctors, patients, and families can affect how decisions are made. Discourse analysts must carefully analyze how language either reinforces or challenges these dynamics and how it affects the patient's autonomy and voice in decision-making. Conclusion. End-of-life care discussions are complex, emotionally charged conversations that involve navigating difficult medical, ethical, and cultural decisions. Through discourse analysis, researchers can explore how language shapes these discussions, influencing how life and death are framed, how decisions are negotiated, and how power dynamics play out between healthcare providers, patients, and families. By examining framing, narrative structures, and the use of language to convey complex medical information, discourse analysis provides insights into how end-of-life care decisions are made and how language can be used to foster compassionate, patient-centered care. Understanding the role of discourse in end-of-life care is essential for improving communication and ensuring that patients' needs, values, and wishes are respected. Frequently asked questions. What are end-of-life care discussions? End-of-life care discussions involve conversations between patients, families, and healthcare providers about treatment preferences, care plans, and decisions regarding the final stages of life. These discussions are marked by sensitive topics such as palliative care, hospice options, and patient autonomy. Why is discourse analysis important in studying these discussions? Discourse analysis helps to understand how language shapes the way life, death, and care are framed, how decisions are negotiated, and how power dynamics between participants influence the conversation. This analysis can reveal the emotional, ethical, and cultural aspects that affect how care is discussed and decisions are made. How does language frame life and death in these discussions? Language is often used to make death seem more natural or less intimidating, easing emotional tension. For example, phrases like, "a natural part of life," can help normalize death, allowing patients and families to discuss care options more comfortably. What role does patient autonomy play in end-of-life care discourse? Patient autonomy is vital, as it emphasizes the patient's right to make informed decisions about their care. Phrases such as, "the decision is yours," "my role is to provide information," position patients as the primary decision-makers while respecting their agency. How are power dynamics analyzed in end-of-life care discussions? Discourse analysis looks at how language can reinforce or mitigate power imbalances, such as when doctors use medical jargon that may limit patient participation. Analysts study whether language promotes shared decision-making or reinforces the medical professional's authority. How does culture affect end-of-life care discussions? Cultural and religious beliefs shape perceptions of acceptable care and influence how discussions are conducted. Analysts examine how language reflects cultural sensitivity, such as when a doctor asks, "Are there beliefs we should consider in your care?" to ensure that discussions respect the patient's background. What are some common emotional and ethical challenges in these conversations? Conversations about end-of-life care can involve ethical dilemmas and intense emotions. Discourse analysis investigates how language manages these aspects, balancing emotional support and ethical considerations, such as in discussions about DNR orders or euthanasia. How do healthcare providers simplify complex medical information? To facilitate informed decision-making, providers often use simplified language like, "This treatment will ease pain but won't extend life significantly." Discourse analysis explores how medical jargon is translated into accessible language to help patients understand their options. What are the key methods used to analyze end-of-life care discourse? Critical discourse analysis, CDA, examines power relations and authority in conversations. Frame analysis looks at how discussions emphasize aspects like comfort or quality of life. Conversation analysis focuses on the structure of interactions, including turn-taking and interruptions. Narrative analysis studies personal stories used to shape discussions and justify decisions. What challenges do discourse analysts face when studying end-of-life care discussions? Emotional complexity, analyzing how participants manage strong emotions like grief and fear. Cultural diversity, accounting for various beliefs and traditions that influence discussions. Power dynamics, identifying how language supports or challenges the authority of medical professionals.